Imagine a scenario where millions of Americans, including children, are at risk of losing their health coverage. This is not a hypothetical situation, but a looming reality as states grapple with the implementation of H.R. 1 and Medicaid work reporting requirements. But here's the shocking part. Many states are woefully unprepared for these federal mandates, which could lead to widespread, avoidable coverage losses. And this is the part most people miss. Even children, who are not the primary target of these policy changes, will bear the brunt of these cuts. H.R. 1, signed into law by President Trump on July 4, 2025, slashes over $1 trillion from Medicaid and marketplace health coverage. This legislation not only strips coverage from many lawfully residing immigrants, but also imposes complex work reporting and renewal policies on states. These changes come just months after the Medicaid unwinding strained state eligibility systems, leaving them ill-equipped to handle the new demands. Warning signs, such as long call center wait times and low rates of automated renewals, suggest that states like Illinois, Missouri, Montana, North Dakota, New Mexico, Utah, and Wisconsin are at high risk of poor implementation, potentially leading to inappropriate coverage losses. Here's where it gets controversial. While H.R. 1 targets the Medicaid adult expansion, its ripple effects will impact children. The One Big Beautiful Act cuts federal funding for Medicaid and CHIP by nearly $1 trillion over 10 years. With almost half of U.S. children covered by Medicaid, states cannot shield them from harm. Child enrollment in Medicaid and CHIP has already declined, and further reductions are expected as state systems struggle to keep up. When parents lose coverage, children are at greater risk, and exemptions for parents of young children may not work smoothly in practice, leaving as many as 1.5 million children vulnerable to losing coverage due to administrative errors or confusion. Marketplace changes under H.R. 1 will add more red tape and increase costs for families. Shortened open enrollment periods, eliminated auto renewals, and new administrative hurdles will make it harder for families to access subsidized coverage. Unless Congress extends enhanced premium tax credits, marketplace enrollees will face steep premium hikes, with the Congressional Budget Office estimating that 4.2 million people will become uninsured. These changes will disproportionately affect the 10 non-expansion states, where a higher share of parents and adults rely on marketplace plans since Medicaid is not an option. But here's the real question. Are states ready to tackle these additional administrative tasks? The answer, based on current performance indicators, is a resounding no. States are already struggling with eligibility and enrollment processes, and adding work reporting, 6-month renewals, and mandatory cost-sharing requirements will only exacerbate the situation. Without swift improvements in administrative readiness, H.R. 1 will deepen state challenges, increase costs, and leave millions of children and families at risk of losing health coverage. To mitigate these impacts, states must leverage technology and strengthen consumer support. Increasing the use of automated renewals, streamlining work reporting compliance checks, and engaging community partners can help ease the burden. However, with implementation deadlines looming, states may resort to costly no-bid contracts, further straining taxpayer resources. The clock is ticking, and the stakes have never been higher. What do you think? Are states up to the challenge, or is this a recipe for disaster? Share your thoughts in the comments below.